In this video, dissection of the axilla and the brachial plexus will be demonstrated. This work was produced by Dr. Carlos Andres Suarez-Quian and Dr. Joel Walensky. Dr. Suarez-Quian is the narrator of this video. Familiarity with the anatomy of the axilla, specifically the brachial plexus, is essential for understanding nerve lesions impacting the upper limb. Let's start the dissection of the axilla. The axilla, which in layman's term is the armpit, is a fat-filled region that is very important because it is a pathway by which vessels and nerves from the trunk pass into the upper limb. It also contains many lymph nodes. This image shows an axilla in which the skin and some of the superficial fascia have been removed. Note the layers of fat in the axilla. The anterior and posterior borders of the axilla are the anterior and posterior axillary folds, which are comprised primarily by the pectoralis major and the teres major combining with the latissimus dorsi muscle, respectively. Dissection of the axilla begins after reflection of the pectoralis major and minor, and then using scissor technique, as shown here, to carefully separate away the fat from the important vessels and nerves found in the axilla. The axillary sheath encases the cord to the brachial plexus and the axillary artery and vein. It needs to be removed in order to clearly see these structures. This sheath is important to anesthesiologists pertaining to upper limb nerve block injections because it prevents the anesthetic solutions from spreading beyond the area surrounding the upper components of the brachial plexus. When using an anterior approach to remove the sheath, as shown here, the axillary vein is the first major structure observed. Clinically, the axillary vein may be used for the placement of central venous catheters for infusion of medications. In this image too, opening the axillary sheath more extensively allows us to observe the axillary artery as well as the vein, and the lateral and medial cords of the brachial plexus. Observing the axillary artery, vein, and the cords of the brachial plexus confirms that we are indeed in the axilla. All these structures are defined to reside within the area of the axilla. The lateral cord of the brachial plexus splits to form the musculocutaneous nerve, which innervates the coracobrachialis, biceps brachii, and brachialis muscles, and the lateral root of the median nerve, which innervates structures in the forearm and hand. The medial cord of the brachial plexus splits to form the ulnar nerve and the medial root of the median nerve, which both also contain fibers that innervate structures in the forearm and the hand. Note, in this specimen, the median nerve forms somewhat more distally than shown in most atlases. This is a normal variation. This image shows how the cords of the brachial plexus surround the axillary artery deep to the pectoralis minor and are named by their relationship to the artery. The medial cord is medial, the lateral cord is lateral, and the posterior cord, which is not visible in this view, is posterior to the artery. An ideal way to understand the naming of the cords of the brachial plexus is to actually look at them in a sagittal section of the cadaver, as shown here. We're looking at the left axilla after removing the arm. Observe the scapula, the clavicle, and the pectoralis major and the pectoralis minor. Now recall the pyramidal shaped space of the axilla indicated in the slide. And now the axillary artery is labeled. The cords of the brachial plexus are named based on their relative position to the artery, and they are the medial, posterior, and lateral cords. The formation of the cords and major nerves of the brachial plexus combine into an M shape that helps greatly with identifying these components. The M is formed by the musculocutaneous nerve, the medial root of the lateral cord, the lateral root of the medial cord, and the ulnar nerve. And here is the M. The posterior cord of the brachial plexus is revealed here in its anatomical position by further dissection and reflection in this region. The posterior cord gives rise primarily to the axillary and radial nerves. A more complete view of the posterior cord is presented here after reflection of the axillary artery and medial and lateral cords of the brachial plexus. Note the branches of this cord to the subscapularis and latissimus dorsi muscles. Axillary fat and lymph nodes were removed to better demonstrate the subscapularis muscle. It forms the posterior wall of the axilla. Here's a labeled image identifying more of the structures visible in the previous slide. Note here the long thoracic nerve, which innervates the serratus anterior muscle. This nerve arises high in the neck and, as you can envision, can be compressed by persons carrying heavy loads on their shoulders, such as lumberjacks. This compression may lead to some paralysis of the serratus anterior, resulting in an inability to raise the upper limb above 90 degrees. This now concludes the presentation on the axilla and the brachial plexus.